If your child is tugging at their ear and they've got a fever, or maybe you've noticed discharge coming out of their ear, then they may have a middle ear infection. A middle ear infection, also known as otitis media, happens when the area behind your child's eardrum gets infected, causing it to become swollen and painful due to fluid being trapped there. Now, these infections are actually very common in children, especially before they turn 2 years old. Adults can also get them, but it's less common. And in this video, we'll cover what a middle ear infection is, causes, symptoms, treatment, plus much more that I think you need to know. So what exactly is a middle ear infection? Well, let's first cover some very basic anatomy because I think that's going to help you better understand your child's condition. Now, the middle ear is the space behind the eardrum. Normally, it's filled with air, but after illnesses like a cold or a sore throat, it can be filled with fluid because the eustachian tube, which connects the middle ear to the back of the throat, gets swollen or blocked. Now, this trapped fluid can then get infected by bacteria or viruses, resulting in pain and pus buildup. Now, young children and babies are more prone to these infections because their eustachian tubes are shorter and more horizontal, making it easier for fluid to get trapped. It doesn't drain out as well because of it being flat or horizontal. In terms of what causes a middle ear infection, well, like I mentioned, they're usually caused by bacteria or viruses from colds. But other risk factors, so things like using a dummy, also known as a pacifier, bottle feeding whilst lying down, exposure to cigarette smoke, close contact with other children, such as at daycare, and conditions like cleft palate or Down syndrome also increase risk. Now, research also shows that boys are more affected than girls, and these infections are more common in winter. In terms of symptoms of a middle ear infection, well, symptoms can start soon after a cold and include ear pain, so you might see a child pulling at their ear, high fever, so a temperature greater than 100.4 Fahrenheit or 38 Celsius, your child being irritable and crying a lot and not being soothed, restlessness, loss of appetite and vomiting. Older children might complain of hearing problems, of a blocked ear, and sometimes the eardrum might burst, releasing the fluid or pus, which can actually relieve the pain. Now, a doctor can usually diagnose a middle ear infection by asking about the symptoms and looking at the eardrum with a small lighted device called an otoscope. Further tests are rarely needed unless the infection doesn't improve or there are complications. In this case, your doctor might take a swab of the ear and send it off to see what bacteria might be causing the ear infections. In terms of treatment, the good news is that most middle ear infections clear up on their own within 3 days. Pain relief with children's paracetamol or ibuprofen is usually all that's needed. Antibiotics are rarely required, but they might be prescribed if the infection is severe, the symptoms last more than 3 days, the child is very young and both ears are affected, or the eardrum has burst. Now, if antibiotics are given, it's important to complete the full course. Otherwise, next time that your child might get an ear infection, the antibiotics may no longer work because bacteria can build up resistance to antibiotics unless you complete the full course or if they're not prescribed properly. In rare cases, surgery might be needed if there are complications. Now, this could involve placing small tubes in the eardrum to drain the fluid or using a needle to remove it. Now, the small tubes are called grommets. In some cases, there are some complications of middle ear infection, and it's worth just being aware of these. Now, these complications can include glue ear, which is where fluid remains in the ear, affecting hearing, but this again usually resolves on its own. It can also result in a burst eardrum. Again, the eardrum usually heals quickly, but long-term or repeated infections might need specialist treatment. Finally, there is a condition called mastoiditis. Now, this is a rare but serious infection of the bone that's behind the ear, and it requires immediate treatment. Now, I've made a separate video on this channel, but essentially the mastoid bone, which is the bony prominence which you can feel behind the ear, becomes inflamed and infected. When you press on it, it might feel boggy or be very tender and very hot and red. Now, this is an emergency and you need to seek medical attention right away if your child has signs of mastoiditis, because if it's left untreated, the infection could spread to the brain. However, as I mentioned, it's rare, but it's just worth being aware of. Now, whilst you can't completely prevent ear infections in children, you can reduce the risk by taking the following precautions. So keeping up to date with their vaccinations, avoiding exposure to tobacco or smoking, breastfeeding, which provides protective nutrients and antibodies, keeping your baby's head elevated during feeding, and teaching good hygiene habits to older children, so washing their hands. Plus, if they go swimming or they're taking a bath, try to avoid getting water into the ears and keeping them as dry as possible. Now, for more help, or if you're concerned about your child's symptoms, contact your doctor, and for more information and resources, check out the description box of this video.